So lip lift surgery involves creating incisions hidden under the nose or on the corners of the lip to change the aesthetic contours, to change the proportionality of the upper lip. And really what a lip lift achieves is reduction of the cutaneous upper lip, the space between the nose and the edge of the red lip, and to show more upper teeth of the mouth when talking or smiling or just parting your lips. These are things that tend to change over time and create a very powerful aging effect on the face when your upper teeth are covered or there's a long length between the nose and the lip. It also can evert or create more fullness of the upper lip, but that's actually best achieved with filler. And so a lot of patients will get a lip lift in order to then be able to do filler. Lip lifts are performed in different ways. Generally speaking, we talk about a lip lift being with an incision under the nose here, and then a corner lift to lift the corners a bit through some small incisions on the corners of the lip. Many patients that get facial aging surgery, like facelifts or brow lifts or blepharoplasties, are also good candidates for lip lifts because all of this stuff ages at the same time. And actually the lip lift itself can be one of the most powerful ways to rejuvenate and make a face more youthful. Lip lifts in isolation can be performed under local anesthesia in an office setting, but can also be performed under anesthesia in an operating room and are frequently performed in conjunction with other facial aging surgeries. But it's a pretty quick, pretty easy procedure. The recovery involves stitches that are in place for about 5 to 7 days and a period of about 10 to 14 days of looking like you've had surgery or having a hard time hiding the telltale signs of surgery without some cover-up. One of the most important considerations with lip lift surgery is the incision. The incision is placed in a very central place on the face under a lot of attention. And so a lot of the lip lift recovery involves very strict restrictions around smiling, around eating certain things, brushing your teeth, things that make your mouth move in certain ways to get an incision that really heals flawlessly without any signs. The other thing to contend with is that the lip can swell a lot in the recovery from a lip lift. There's lots of things I do in performing lip lifts that minimize swelling, both in terms of the surgical technique, but also recovery technique. But in general, people have to be aware that in the recovery, there can be more swelling than they want, and that can look more obvious, like something's been done to their lip. So I love lip lifts because it really is a very direct, really straightforward way in the right candidate to create a very powerful change in facial aesthetics without doing too much surgery. As long as people are comfortable with what's involved in the recovery, what's involved in healing, it's a great procedure to provide a very powerful effect. And a lot of times it's a nice adjunct procedure, almost like a cherry on top for things like facelifts, brow lifts, or other lifting procedures of the face.